Hyatt from Maxillosoft, one of the co-creators. Just want to go over an implant treatment with using the EMR. So here's our dashboard, and green means the patient's ready to be seen. We're going to touch on that patient, pull up their treatment page. It's anesthesia record, implant, discharge. We know what the treatment plan is. It's listed right here. Now these buttons here are already touched, but they'll usually show up as red, and they force you to review the patient's history. So you subscribe through that and submit that. Forces you that you discussed, make sure that you discuss things with the patient, their risk, benefits, and alternatives. And as well as it shows you that you had a consent that was signed ahead of time. It forces you to check that you have consent that's performed. There's no allergies. The vital signs will show up here from your monitor. We always perform a timeout in which we discuss who the patient is, why they're here, identify the operative sites, so that's identified, that's listed on your report. Whether or not they're MPO, maybe they're MPO, and let's verify that they are. ASA1, the Malapati, well, their EKG, they got normal sinus rhythm, maybe a moderate anxiety level. These are the monitors we will use. Let's say we start an IV with a catheter, nasal cannula, the patient is reclined 45 degrees. Given a local anesthesia, and this gives you this local anesthesia form. Let's say we're going to give just a couple cartridges of lidocaine for infiltration in that area. We're giving some oxygen, 5 liters a minute. And let's say we're giving them some remifentanil propofol. Usually I do this as a total dose in the end, 120 milligrams of propofol. I generally give a little bit of Versed. That's the total dose. So this will be in the end when I'm filling things out. You can give 8 milligrams of Decadron too. But let's go to treatment. Here's the implant treatment page. Now personally, I use a lot of guidance, and I use the XNav a lot. So the XNav, that gives me a shortcut. And I use Straumann, which is #1 implant company in the world, but we have every implant, virtually the big implant companies that most of our betas have requested are all on here. But let's say I'm using a Straumann regular connection, SLA active, 4.1 by 12 millimeter implant in there. We're going to put a regular conical abutment on there. The torque value we put in was 30 Newton centimeters. Position was excellent. No dehiscence, no grafting, but that's all possible there. The implant cap was exposed. There was no sutures. And then you can either do the same thing for number 9, or I can apply that for number 9. Or I can go through the same page, and now number 9 is filled in as it pulls. Whoop, let's go back. Here's number 9 now. Pull it up the same way. So you see that's all filled in. We're writing prescription for the patient. We have shortcuts for that. A lot of times I'll write hydrocodone, which is narcotic, obviously, so we have to record that we discuss the risks of opiates with the patients. That gives you the opportunity to record that. Here's our prescriptions, they're our shortcut, and then we can print that out. Then we have a list of all the prescriptions that are written for this patient over time. Go to discharge for the patient. We're going to make sure, we usually give them some oxygen prior to their discharge. We're going over instructions. Generally, it's taking a periapical radiograph of any implant. Their next visit, I'm going to see them in maybe a week. And then they're going to end treatment, send to the office, and the patient's ready to go. Be sure apply. So one of the interesting things about the program is having a task list. So all the things I neglected to do, or let's say my partner saw one of my patients, well, this will show up in a task list. Here's the task list, and these are all things that haven't been done and things I need to do. I didn't finish this up. I need to finish these consultations, or I wanted to dictate a letter to somebody, or add a medical clearance form to somebody. Here's another consultation dictation. So it gives me an idea of what I still need to do, and this is helpful for me in the day if I've missed something or forgotten something, or I wanted to put something aside to spend a little more time on an outside patient treatment time. All right, this program has been a game changer. I can't imagine not using it in our practice. I just can't walk around without the tablet in my hand all the time, because I have access. I know where all my patients are, who's what, who's where, what's going on. And so it tells me that not only that, our records are so much better, our insurance claims are cleaner because the information's better, things are legible. It just makes a big difference. You don't understand what a difference this program can make in your life until you really start using it.